Our next topic is vitamin B6 or pyridoxine. So vitamin B6 or pyridoxine, it is one of the B vitamins, and its active form is pyridoxal 5-phosphate. It is a coenzyme in more than 140 enzyme reactions in amino acid and glucose and lipid metabolism. Normal range should be 1 milligram to 2 milligram per day, and the sources are beef, fish, dairy, eggs. So vitamin B6 deficiency symptoms includes rashes, inflammation around mouth, eyes, and neurological effects includes drowsiness, peripheral neuropathy affecting sensory and motor nerves in hands and feet. And coming to the functions, neurotransmitter. The functions of vitamin B6, they are neurotransmitter synthesis, histamine synthesis, hemoglobin synthesis, and gene expression. So the transaminases, they breaks down amino acid with pyridoxine as cofactor, and serine racemase, this synthesizes neuromodulator D-serine. This is pyridoxine dependent. So therefore pyridoxine is a coenzyme needed for proper function of enzymes as in catabolism of methionine, cysteine, etc. And pyridoxine is also a cofactor for enzymes that allows selenium to be used from the dietary form. And so pyridoxine is also required for conversion of tryptophan to niacin, and is also cofactor in biosynthesis of neurotransmitters such as serotonin, dopamine, epinephrine, norepinephrine, gamma aminobutyric acid. And so pyridoxine, it is required in glucose metabolism, lipid metabolism, hemoglobin synthesis and function, and gene expression. Coming to the uses, isoniazid is antibiotic which is used for the treatment of TB, tuberculosis. So common side effects with this drug is numbness in hands and feet, that is peripheral neuropathy. So co-treatment with vitamin B6, it alleviates numbness, that is reduces or relieves or diminishes the numbness. And so coming to the sources, milk, egg, fish, meat, apples, orange, pears, etc. But milk, when in powder form, when dried, it loses 70% of its B6 content, vitamin B6 content. And so in 100 grams of meat, beef, liver, fish, etc. This thing can get 1 milligram of vitamin B6, and in 100 grams of chicken, 0.7 milligram B6, banana 0.4 milligram, and corns, milk, yogurt, milk 1 cup, yogurt 1 cup, almonds 100 grams, bread, rice, beans, eggs 0.1 milligram of B6, vitamin B6. And in 100 grams of potato, 0.3 milligram of B6, bell peppers, peanuts 0.3 milligram. And in 100 grams of avocado, spinach, chickpeas, avocado 0.25 milligram B6 content, spinach 0.2 milligram B6 content, and chickpeas 0.1 milligram B6 content. And so coming to the deficiency of B6, the clinical syndrome for vitamin B6 deficiency is seborrheic dermatitis and atrophic glossitis, conjunctivitis. So seborrheic dermatitis, skin disorder, scaly, greasy, flaky skin, itchy and inflamed, and areas of the skin rich in oil producing glands, usually they are affected. Often they are affected as the scalp, face and chest. Atrophic glossitis, then there will be ulceration, and angular cheilitis, conjunctivitis, intertrigo. So this is the clinical syndrome. And neurological symptoms like somnolence and confusion, depression, neuropathy due to impaired sphingosine synthesis, and microcytic anemia due to impaired heme synthesis, etc. So this is all we learned about vitamin B6.